Peace. My name is G Man of Law. My artist name is P Funk City G. And I'd like to welcome you to The Naked Truth. Um, I want to start with healthcare because I think on my last episode I had something about Jamaican health care, and yeah, sister by the name of Doris. Excuse me, I'm a smoke in this session too because I got a video shoot and I'm pressed for time. I haven't even able to like roll, so I'm up smoke and get my, my normal. I usually like play music. Um, Love Don't Love Nobody by the Spinners. You know what I mean? While I'm shaving and taking a shower and getting ready and all of that, but I didn't have that time today. So excuse me, I'm gonna puff a little, get my mind, get my meds and all of that. I normally don't do that. You normally don't do this. But what I want to talk about is, again, the Jamaican healthcare. I stand on what I said. Jamaica has an amazing healthcare system. And I'm not saying that it has the best technology, but it has the best operators. And let's look at it like Usain Bolt. Usain Bolt probably didn't have the same technology and, expertise. Well, I mean, he might have had expertise, but the training equipment, America, is so-called one of the richest countries in the world, so they're going to have the supposedly best equipment, technology, and all of that. The thing is that it's not about the technology, it's about the people running the technology, Usain Bolt might not have the best technology, but he had people dedicated to bringing the best out of him, and that's been my experience here in Jamaica. They have faults like the American healthcare system, but I mean one thing for sure is that black people in America, whether you're Jamaican, Haitian, African American, so-called, or Nigerian, once you go into that system of healthcare in America, just being black, you're more susceptible to bad healthcare. You're not going to get the same healthcare as your Caucasian counterparts. That's proven in the maternity ward, where there's children dying in the hospital, black people dying and getting different services from the staffs there. So what I meant by Jamaica had the best healthcare, my experience is when I came to Jamaica, I didn't have asthma, but in 2001, 9/11, I was working in Manhattan, downtown Manhattan, on 170 Varick Street, with Deb Prez. All right, the session. I think we had a session Sunday. We worked all day Sunday. No, matter of fact, we worked all day Saturday. We had Sunday off. I was exhausted because Dead Prez works very hard. Actually, they're the hardest working artists that I've ever worked with. You know what I'm saying? They work very hard, long hours. They start early, end late, and they're dedicated to their craft. So, to make a long story short, Dead Prez, I didn't go to work. They had off Sunday. I was scheduled to work Monday. They called me, Dead Prez, blah, blah, blah. I was like, I passed on it because I was just exhausted. I was exhausted. The session was supposed to be like Monday. No, okay. All right, because this been some time. It's coming back to my brain. All right. took off Saturday. No, I'm sorry. I worked Saturday. I took off Sunday. They were supposed to work Sunday because they were finishing their project. And so that would have took me into the city by Monday morning when 9/11 happened. So what happened is, Dead Prez, I canceled on him. That's the first time I ever canceled on a session. Like, not canceled, but like, I can't do it. Got to find somebody else. And so what happened is they were leaving. The engineer that worked that session on that Sunday was leaving the studio, and he said when he was walking down the street, he just seen all these people walking by him like they were covered with like it looked like white flour. He didn't understand what was going on. And so what happened was that was a result of the building falling, and all of the debris and smoke and all of the ashes, and some people were covered with that, and fleeing from that. So what happened was, that below 14th Street in Manhattan was closed for about 2 weeks. So the studio was closed for about 2 weeks. Couldn't even go downtown. I couldn't even go, pick up my check from the studio for 2 weeks. And so what happened is, to make a very long story short, the air quality was messed up, and everybody who was down there got sick. Some type of respiratory illness or cancer or different illnesses. I had been down there, and when you go down there, I worked down there for about another year. I left in 2002, September of 2002. I worked, 100-hour weeks for the next year. And so, make a long story short, is that, I believe that's what caused me to have asthmatic symptoms. And actually, it's crazy because, they run ads like, in New York or, on TV. If you were in it, in downtown Manhattan, call this lawyer, you could be part of a group lawsuit and all of that. But what happens with that is that whenever I called, they always say like I was 1 block short. If I was just 1 block further, I would fall, and all of that. But I think it's more like they want to give they don't want to give black a man money. You know what I'm saying? They can tell your tone when you answer the phone. But anyway, it might not be that. It could be other reasons. But I didn't qualify for the I think class action lawsuit. So anyway, to make a long story short, I'm in Jamaica. I started developing asthma symptoms, and I call it cold, and what I mean. I went to the clinic, the hospital, and so what happened, because I couldn't breathe, so they gave me an asthma treatment. And started treating me for asthma, gave me a pump and all that stuff, and that's what really helped. I was smoking cigarettes at the time too, you know what I mean, and it was like, it was crazy. I know people gonna say the ganja don't help, but ganja doesn't affect asthma. You know what I mean? There's a lot of cats with asthma that smoke weed. I've stopped smoking weed for a year at a time, and I still had to take the pump and that. So as far as asthma, it doesn't affect the asthma. But of course, empirical information will tell you it will. But got to just dig deeper sometimes. Empirical knowledge is not enough. But so anyway, I started getting the pump and all of that. All right. So now let's go fast forward to 2020 when I guess it's safe to say COVID, without being banned, but COVID hit. And so when COVID hit, I was, they were talking about the people in who have respiratory issues are the most, diabetes and certain things, ailments, were more susceptible to getting sick and dying and all of that. So my concern was my son, you know what I mean? Because it was like, who's going to raise my son? You know what I'm saying? Yeah, I mean, trust me, my family, like, there's about 10 people that want to, be raised by son, you know what I'm saying? But they're not going to be able to raise them like I raised them, you know what I mean? I'm preparing them for something special, and to help black people and, things of that nature. They wouldn't be able to do that. They would prepare them for a job, and I'm preparing them to create opportunities for people, you know what I mean? So creating opportunities, jobs, unifying, the black world outside of America. Because America has, access to the so-called greatest information in the world, but it's still, with an imperial mindset. They're, building their businesses, and that's strengthening the U.S. economy and, making, capitalism, stronger, and that in itself oppresses our people. It's the dollar that separates us, right? I mean, I pay a little extra so I don't have to be in the hood. I pay for, rent. So I don't have to be in the hood. So, it definitely, like, money separates us. And then there's people that's paying more than me that's living even more, like, more, safe, secluded, you know what I mean? Peaceful, you know. But, but anyway, so with the COVID going on, it was like I was concerned, like, what's gonna happen to my son? You know what I mean? So I had, worked myself, and I worked myself into a frenzy, and I got, a little stressed out, worried about him. You know what I mean? And what would happen to him is something that happened to me. Who could I depend on to follow through, to teach him what he needed to be taught, according to the teachings of the Honorable Elijah Muhammad, who taught us Islam that's older than the sun, moon, and stars. And that's what changed my life around. You know what I mean? Like, I would have never came to Jamaica if, I hadn't had the lessons. The lessons taught that, we are the original people, the original inhabitants of the planet Earth. And wherever you go on the planet, you're going to find black people. And they call them Aboriginal because we are the original people. We were actually there in Europe before the Europeans, but the Earth, had a different shape and size at that time. So, anyway, so I got stressed out, you know what I mean, and concerned, and what happens when we get sick, stressed out, concerned, stressed out, our immune system weakens and we're susceptible to sickness, disease, illness. And that's what happened to me. I caught a cold, for my son. Now I ain't gonna say it for my son, but there was a flu going around or something going around. I got, caught it, couldn't shake it. At one point, it was hard for me to breathe. Like, even my inhaler was the helper, the emergency helper, or the emergency inhaler, or the regular day-to-day inhaler. So what happened was that it was like, I need to get this checked out. You know what I'm saying? So, called my son's mother, to make arrangements for my son, because I think my son was probably about 10 or 11 at that time. Hey, I gotta handle this, you know what I mean? So she was like, I bet, I'm gonna get some of my peoples over there, taxi, pick you up, take you out. Beautiful, thank you. So I couldn't even walk outside because, like, whenever, if you move, you need oxygen to, what I mean, fuel the body, the muscles and all of that. I couldn't even, so he had to, come into the gate, pull up to the steps, and, I get in. I couldn't get to the hospital. It was right down the street. Couldn't get out, couldn't get like, like I couldn't walk without, you know what I'm saying? So they put me in a wheelchair, wheeled me in. With asthma here, they put you, right into the machine. The doctor was like, the nurse was, took my information, put me straight through. The doctor came, gave me what they call it? They could call it a treatment. Give me a treatment. And so I'm taking the treatment. I had a full treatment, and I was the same, like no improvement. Usually, like I said, the first time I knew I had asthma was coming to the hospital. It was like, yo, I can't breathe. They're like, okay, go, because in the Jamaican hospital, and anybody here tell you like it's like all day thing, like especially the free hospitals. Go to the hospital, and I wait all day in the emergency room. You know what I'm saying? They give you a number and you gotta wait. But with the asthma, they let you go through. You know what I mean? And all of that. So that's I came in. The nurse signed me in. The doctor gave me the treatment. The treatment didn't do anything. With no improvement. So the doctor, so I called the doctor. Doc, yo, I need something else, man. Like, and like Doris said in the comments, or somebody else said in the comments, like they don't talk to you, they don't treat you with respect. That's true. What happened was he was like, you gonna be alright, yo. Next thing I know, I passed out. You know what I'm saying? I couldn't breathe, and I just collapsed. This was probably about 8 o'clock in the morning. When I wake up, I'm in the bed, 10 o'clock at night, with a lady, a nurse at my bedside, with like a clear football, connected into my mouth, into my system, pushing air into my lungs. They didn't have the technology for a machine, ventilator, whatever you call it. So I wake up, this lady she had to been doing it for, you know what I mean? That's what I'm talking about is amazing. It's the people that run the facilities. A system a system's strengths and weaknesses is determined by the people who implement the system. And if someone is not fighting for your survival, you're done in hospital. You're done in healthcare. It takes people who are concerned and they follow through and make sure that you have all the information that you need to get well and the determination to figure out what's going on to help you get better. That's what happened. Jamaica has flaws. None of the Jamaican doctors came and was like, yo, this is what's going on, this and that. But there was a Cuban doctor. Like I said, the Cubans are here. They come and are an integral part of the healthcare system. So what happened is she came, explained to me, beautiful too. She was a cutie. Anyway, she came and explained to me, yo, you passed out. You know what I mean? We had to bring you back to life. You know what I'm saying? I'm sitting there like, what? You know what I mean? Like, it was so crazy. I had what I don't know if I think it's called a catheter, but they had something going into the penis. You know what I'm saying? They had something going in my penis so I could pee. You know what I'm saying? Like, so I couldn't even get up, go to the bathroom. I was like, yo, you know what I mean? Because I'm up here like, yo, the first thing I'm thinking is like my son, like, yo, I gotta get home. You know what I mean? It's like, nah, you can't, relax. You can't go nowhere right now. So, I was in there for probably, about a day and a half, maybe 2 days or something like that. and being supervised. But once I woke up, like the doctor said, yo, okay, told the nurse she could stop, pressing the football. It was like, it was like she was doing this for 10 hours. You know what I'm saying? Now, what, 10 o'clock, 12 hours? No, 14 hours. It's crazy. You know what I'm saying? But anyway, that's what I'm talking about. Healthcare system to me in Jamaica is amazing. Just like Usain Bolt, he's probably the greatest runner, racer, 100 sprinter in the history. I ain't gonna say in the history of the world, but in the history of like the colonial competitive record keeping and all of that for sure. And he didn't have the best technology, but he had people that followed through. And I've talked about that in another episode. That's one thing that Puff strived was to follow through. You know what I mean? And it's very important, to follow through. And that's what I got, as far as healthcare. I might have died in America. The way that they were piling up bodies. And that's my word. You know what I'm saying? They were putting people in the hospital. Nobody could come visit them. Nobody can, like I said, we've been doing the hospital thing for years because my mother was sick. She was obese. And so, overweight and obesity, causes health problems. You know what I'm saying? I mean, so like I said, we were familiar with the healthcare, and part of, helping loved ones to get better is being there, holding their hand, coming to see them every day. Hey, mommy, how you doing? Okay, yeah, all right, we're gonna talk to the doctor. You know what I mean? And also when the doctors see people getting love, it ignites them to follow through on their job. You know what I mean? Setting a standard. So that's what I got. And I was in the in the hospital by myself because my son was with his mom. So I have nothing bad to say. They saved my life. Matter of fact, they brought me back to life. You know what I mean? I would have been gone. You know what I'm saying? So I think, every time I see them, I thank them. You know what I mean? One nurse, one of the nurses, is my neighbor, the one, the intake nurse or whatever that take your information and heart rate and blood pressure and all of that. So, yo, hey, how you doing? You save any lives today? You know what I'm saying? Because, I know how special she is. But I gotta say one thing too, like, one thing, about, my experience here in Jamaica is, like a lot of Jamaican people feel that, like they're poor, like that, it's sad to hear the kids, say I'm poor, and you know what I mean, we don't have this, we don't have that, and the thing is, a lot of these people are living a more quality life than people in America. Imagine somebody in Alabama, small town in Alabama, country. They're living in a board house, no education, and they go to the hospital. What's their experience going to be? I had to go to the hospital last time I was in the States. My son, in here we cook home food. My son eats all home cooked meals except maybe once a week, and twice at the most. And he likes patties too, so you know what I mean. So maybe 3 times a week, But got to America, you know what I'm saying? Like my family eat out all the time, you know what I'm saying? So his body couldn't handle that, you know what I'm saying? His body was like, yeah. He hadn't taken a dump. My doo-doo. Excuse me, I'm sorry. I don't know what happened, but the thing just went off. But he hadn't gone to the bathroom for months. Not for months, for weeks, about 2 weeks. So, make a long story short, we ended up having to take him to the doctor. You know what I mean? And what's crazy was a Jamaican lady. Jamaican nurse that helped us. The white people ain't want to help us. You know what I'm saying? It was a black lady that followed through. You know what I mean? And made sure that my son, like, they put some stuff in him to loosen up the bowels, and you know what I mean? Yo, it was crazy. You know what I'm saying? They, them, the Caucasians was behind the desk, like, like, obviously, you know what I mean, that they didn't want to, deal with us. You know what I mean? And that was my experience. You know? That was my experience, there. And so he was there probably maybe 2 hours. We got a bill for $7,000. That's the difference. You know what I'm saying? That's the difference in healthcare in Jamaica. And actually, we had to go to another hospital because they wouldn't take us because I didn't have insurance. You know what I mean? So can't nobody tell me about Jamaica, I love Jamaica, And it's not like, like I'm saying, like, Jamaica is, the only place, you know what I mean? But, a lot of places are better than America. And once once we leave, once my son gets about a little older, we're gonna leave here. We're gonna go to Africa. You know what I'm saying? Possibly the Sahel region, because that looks very inviting right now. But that's all I wanted to say pretty much on that. You know what I mean? So Doris, yeah, you right. Doris, she must be Jamaican. She wasn't playing with me. She was like, "Shut up!" in the comments. She said, "Shut up! You don't know what you talking about." You know what I mean? So Doris, I love you. You know what I mean, and I appreciate your comment. You know what I'm saying? I appreciate everybody comment. You know what I mean, whether it's positive, negative. You know what I mean? I thank everybody for their time. I'm going to keep this short because I'm going to, like I said, I got a video shoot today, and I'm going to start making the videos a little shorter, probably about 30 to 45 minutes. One thing I wanted to discuss was, my time with at Chung King. I had a session with Mobb Deep. Chris Lighty was their manager. And they were beefing with Jay-Z. And I just want to show you how, like, you know what I mean? There's nothing on Chris Lighty because Chris Lighty is a beautiful person. Beautiful. You know what I mean? Like, I have the utmost respect for him. May he rest in peace. You know what I mean? He was just a beautiful, beautiful person. I met him, his wife, his widow, before they were married. I think she was like an executive at American Express or something like that. I remember him saying. But anyway, we used to chat. You know what I mean? He was down to earth. But this story right here was the time that they were beefing with Jay, and they were trying to get Prodigy and Havoc to like come at Jay. You know what I mean? Like they wanted more diss records from him. And I remember Prodigy, like, you know what I mean? Like he was like, yo. You know what I mean? It's like he ain't want it. Not that he ain't want war. It was like, FJ. You know what I mean? Like, we moving on, man. You know what I'm saying? Like, that nigga don't do nothing, move us no way. So my point is, like, the industry keep all of this, a lot of this rap beat going. You know what I mean? Cats want to, like, dead stuff, move on, and these cats, they're like keeping, black men beefing with each other, It's sad, So like I said, like, that's why, we're focused on the independence. You know what I mean? Being able to say what we want, when we want, releasing how we want, And like I said before, we still are regulated by a certain extent because of the platforms. Even like with this, I have to be careful what I talk about. You know what I mean? Because of YouTube, they got, like certain things they're not going to allow to be said. We know that COVID days, the doctors that was talking about, like the real things that really could help us and positive, they were shut down. You can't even find them nowhere online anymore. You know what I mean? So, we know the system is not here to help us. It's to enslave us. And one of the things that what happened was they took the chains off our wrists ankles, the shackles off us, and put it on our minds. So now we walk. We don't need shackles, and we showing up at the plantation every single day, living check to check, eating bad foods, becoming unhealthy. You know, but that's enough on that. I want to really next talk about 50 Cent. You know, and that thing going on with Meech, and 50 Cent is a special brother. And he reminds me of DJ Cheese. He's like a big brother to me. We're not speaking right now because there's some gangster things that had happened, and like I didn't like how it happened. Things were divisive, and I'm sure he had a story too. I'm anxious to hear, but hopefully one day, we'll be able to unite and work together, because he's still the greatest DJ in the world, in the history of the world. To me, he's the Usain Bolt of DJ. But him and 50 Cent have a lot in common. You know what I'm saying? They're like, they just street. You know what I'm saying? Like, they comfortable in the most gutter situations. You know what I'm saying? And they thrive on, like white people love them too. You know what I'm saying? But one thing about 50 and Cheese that they have in common is, like, you never see them mad. Like he destroyed Big Meech with a smile on his face. He didn't raise his voice. He didn't, and that's what I respect, because it's like when I turn up, it's like, I'm aggressive, and then I do things that I regret sometimes. You know what I'm saying? And that's what I'm working on now. Is being able to, like let shit go, and it's like, I'm good. I thought I was good at it, but it's something that I always have to be conscious of. You know what I'm saying? Because I have a bad temper. Or I should say I had one, and I had an experience this week that showed me that I still need work, in that area. So I'm gonna leave it there. This is gonna be short and sweet. I love, and appreciate your time. And I wish you the best. I wish you a great week. And I hope we all are able to live our dreams. Like I am. I'm living my dream. It might not be to the standards of some, but by the standards of the law, I'm doing a great job, and I'm grateful for that. Anyway, love, peace, and happiness. P Funk City G.